So starting with the venous drainage of the lower limb, the veins of the lower limb are broadly divided into three categories, three groups. Superficial veins that are located above the deep fascia in the leg, deep veins that are located below the deep fascia, and then we have perforators that connect the superficial veins with the deep veins by perforating through the deep fascia of the lower limb. The superficial veins, they include great saphenous vein, small saphenous vein. The deep veins are usually the veiny comitants that accompany the arteries in the lower limb. And these include the femoral vein, popliteal vein, profunda femoris, peroneal, anterior posterior tibial, and the plantar veins. Then we have perforators. These are short vessels that connect the superficial veins with the deep veins, and they are called perforators because they pierce and perforate through the deep fascia of the lower limb in order to connect the superficial veins with the deep veins. These include the ankle perforators, perforators of the cocket, perforators of Boyd, Dodds, and Hunter's perforators. Regarding the superficial veins of the lower limb, these veins are located within the superficial fascia of the lower limb that is above the deep fascia. This is why they are called superficial veins, whereas the deep veins are located deep to the deep fascia of the lower limb. There are two major vessels associated with the superficial system of veins in the lower limb. These are the great saphenous vein and a small saphenous vein. So both of these veins, they arise from the lateral and the medial sides of the dorsal venous arch. The great saphenous vein, after arising, it ascends directly in front of the medial malleolus. It accompanies the saphenous nerve in the leg. This is an MCQ. Then it continues to ascend within the superficial fascia of the leg medially and passes behind the knee joint. It passes behind the knee joint. It continues forward on the medial side in the thigh, and finally through the lower part of the saphenous opening in the deep fascia, it joins the femoral vein below and lateral to the pubic tubercle. Again an MCQ. It possesses numerous valves, about 10 to 20 in number. So it is one of those veins of the lower limb that possess valves. Behind the knee joint, it is often connected with the small saphenous vein. And great saphenous vein itself is connected with the deep veins of the lower limb with the help of different groups of perforators. The tributaries of the great saphenous vein include the superficial circumflex, superficial epigastric, superficial external pudendal, accessory saphenous vein, the medial marginal, and the various cutaneous veins. They drain into the great saphenous vein. So small saphenous vein begins as the lateral continuation of the dorsal venous arch. It ascends behind the lateral malleolus and continues to ascend within the back of the leg. It follows the lateral border of the tendocalcaneus, reaches up till the middle of the back of the leg, where it pierces the deep fascia between the two heads of the gastrocnemius, lateral and medial, so that in the lower part of the popliteal fossa, it drains into the popliteal vein. And sometimes behind the knee joint, it may communicate with the great saphenous vein. Its tributaries include small veins from the back of leg, communicating veins which communicate it with the deep veins of the foot, and some anastomotic veins joining it with the great saphenous vein. So, what are perforators? Why are they called perforators? Perforators are basically the small vessels that connect the superficial veins of the lower limb with the deep veins of the lower limb. They are called perforators because they pierce these deep fascia. They pierce the deep fascia, they perforate the deep fascia in order to establish the communication between the two types of veins in the two sets of veins in the lower limb, that is superficial and deep. They contain valves in order to keep the blood flow unidirectional from superficial to deep. They are of about 4 to 5 groups. They are called ankle perforators, cockets, dots, voids, and hunters. These 4 to 5 groups of perforators, they have their own location and their own set of communication between the two sets of veins. For example, let's start with the ankle perforators. So the ankle perforators, they further comprise of various small groups that include medial, lateral, and anterior around the region of ankle. The medial group of ankle perforators connects the medial plantar vein with the great saphenous vein. The lateral ankle perforator connects the lateral plantar vein with the small saphenous vein, whereas the anterior ankle perforator connects the dorsal foot arch with the fibular and anterior tibial veins. Second very famous perforator of the lower limb is called cockets. These perforators are located just above the medial malleolus or lower 2/3 of the leg, and they connect the posterior arch vein with the vena comitans of posterior tibial artery. Now, what about posterior arch vein? If you can see in the diagram, here you can see the posterior arch vein, because Cocket's perforator itself comprises of at least 3 groups. These 3 groups of Cocket's perforators are connected with each other in the form of arcades. And these arcades, as the name is indicating, they are forming a straight vein. This vein is labeled as posterior arch vein. This vein is basically connecting the 3 groups of Cocket's perforators. So Cocket's perforators, they connect the posterior arch vein with the vena comitans of the posterior tibial artery, which are obviously the deep set of veins. Next, we have the void perforators, also called knee perforators. They are located either at the level of knee joint or below the knee joint. And they connect the posterior tibial vein and great saphenous vein with each other. Then we have two groups of perforators that are located within the thigh, upper and lower aspects of thigh medially. They connect the femoral vein in the thigh with the great saphenous vein, and collectively the dot and hunter, the name is indicating hunters mean this perforator vein is located within the adductor canal. So these two sets of perforators together are labeled as, or they are collectively called, perforators of the femoral canal. And they connect the both of them, dot and hunters. Both of these perforators, they connect the femoral vein with the great saphenous vein. So here you can see the long saphenous or the great saphenous vein, and here we have the femoral vein. And dots and hunters, perforators, are connecting the two with each other. So what are those factors that help in the venous return of the lower limb? Negative thoracic pressure, calf muscle pump, competent valves, and venae commitans, that is the paired veins that surround an artery. And with the help of the pulsation of that artery, venous return is maintained in the venae commitans and in the lower limb as a whole.